So the good news is, if you have a tattoo that you don't like, if you had an impulsive moment, we can help with a little effort to erase the permanent tattoo ink with our laser tattoo removal. Hello and welcome to this edition of the Wise Medical Minute. Today we're going to talk about tattoo removal. We've had some recent inquiries and we're beefing up our services in that regard, so I thought it worth a quick primer on what's involved with tattoo removal. Now, we use a laser tattoo removal technique. We use an ND-YAG Q-switched type laser, which is not the most ultra-modern technology, but the newer, greater, better stuff we've experimented with have problems that we've decided to avoid, and I'll get back to that in a minute. The downside of the previous generation of technology is it takes more treatments. But with laser tattoo removal, basically your goal is to leave the skin normal, as if there was never a tattoo there when you finish your treatment. That is not as consistently feasible with the newer technologies. The newer technologies require fewer treatments and it removes the ink more efficiently, but there's a much higher incidence of complications like hypopigmentation or hyperpigmentation or scarring. That means you end up with a light spot or a dark spot or a scar where the tattoo used to be. So the previous generation technology that we've decided to stick with, we have the downside of more than a few treatments for most tattoos. And therefore, if you're patient, you end up with normal skin, but it's going to take a little bit of an investment of time. Now let's talk about how the tattoo works, how the tattoo removal laser works. The laser is specific for a specific color of ink, okay? So the laser seeks out pigment and literally breaks up the ink into smaller particles. And these things are color specific, and we have to change the wavelength of the laser based on the wavelength or the color of the tattoo. So after the laser breaks up the ink into smaller particles, then the immune system does most of the hard work. And that just takes time. That's the downside of laser tattoo removal. Your white blood cells literally eat the ink that is broken up into small enough particles that the white cells can engulf them. And that ink is removed over weeks and not days. So there's no advantage when people are in a hurry to crowding treatments every week. I don't think that's smart. Every 2 weeks is still too soon. We see improvement spontaneously after one treatment, even months later. But I think it's reasonable. Most of the fading that you'll see after a treatment takes place within 4 to 6 weeks. So I like to space out the treatments 4 to 6 weeks apart. That allows you time to get good enough healing of the skin, as well as making sure you can safely, if necessary, increase the settings on the laser and be a little more aggressive with subsequent treatments. That way you get complete resolution without damaging the skin, and you work your way up from a conservative setting to a more aggressive setting as the skin tells you you can do safely. So that's one point. Now, how common are tattoos? I was a little surprised at the actual statistics that are being published, because I thought the numbers were higher. But I'm told 45% of people between the age of 26 and 42 have a tattoo. I think that number is higher. And I know for a younger crowd, that number is growing. Now, something greater than 1 in 4 out of those people have some tattoo regret. So the good news is, if you have a tattoo that you don't like, if you had an impulsive moment when you did something stupid in the past, we can help with a little effort to erase the permanent tattoo ink with our laser tattoo removal. Now, the concept we also have to stress is a little bit of aftercare. Just simple cleaning of the skin, antibiotic ointment, and avoidance of the sun after laser treatment allows for a lot greater success with less in the way of complications. So here at the Wise Image Enhancement Center, we only use the most talented in the way of laser practitioners to perform these procedures. So Noreen, come up here. I want them to see our laser practitioner, and if I don't do the procedure, you'll be seeing Noreen, okay? And sometimes we'll gang tackle these procedures and we'll make sure we get the best in the way of outcomes. So recognize Noreen as your laser practitioner who's going to be doing most of the work after we come up with a treatment plan for your tattoo removal. Last but not least, we want to also encourage you to improve your immunity with good nutrition. And I'm going to save that for a future video, but healthy eating habits guarantees that your success with tattoo removal will be even greater. Thanks for your attention, and I welcome you to suggest topics for future editions of the Wise Medical Minute, and email me, info@wisemedicalcenter.com, and we'll include your questions in a future video.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.